This is my project for psych and film over the movie Hunger Games Mockingjay Part 1, and my disorder is post-traumatic stress disorder, and my name is Glenn Ward. So in the movie Hunger Games Mockingjay Part 1, my character's name is Katniss Everdeen. She was first introduced to us in the first movie of the Hunger Games as an ordinary District 12 girl, and they had the Reaping, which is when they decide what the contestants are going to be for the Hunger Games, and she decided to take her sister's place. In the Hunger Games, the contestants must fight to the death with the other contestants, and the only one left surviving gets to go home. In the Hunger Games, she falls in love with her fellow male contestant Peta, who is also from District 12. They both emerge as the victors as their love story captures the hearts of everyone watching. This is the first time that two contestants are able to go home alive, and Katniss shows that she's a rebel against the Capitol. The next year, they decided to draft the contestants from the previous pool of winners, and Katniss and Peta are once again sent back to fight for their lives. The other contestants create a plan to escape from the arena and travel to District 13, which the Capitol has claimed was destroyed. Katniss is able to escape, but Peta is not, and he is captured by the Capitol. The post traumatic stress disorder is when people experience events that could be extremely stressful or traumatic that make them have an increased risk of developing PTSD. It is categorized as a trauma and stress related disorder, and people that suffer from PTSD often deal with nightmares, memories of their events, flashbacks, avoiding things that are related to their events, negative emotional states, detaching from others, outbursts, and startling responses. In Panem, if Katniss was to go to a therapist or a medical professional in her country, I don't think that she would be diagnosed with PTSD. In this culture and film, they were extremely focused on the war against the Capitol. Katniss was their symbol, and if she was diagnosed with PTSD, she would not be able to be effective. They wanted her to be perfect for their cause, and I think if she wanted to get diagnosed with something, she would be diagnosed with some kind of a sleeping problem and be given sleep medicine. In the opening scene where Katniss explains that she's having nightmares, her peers claim that she just needs sleep and that they could help her sleep. In our world, post traumatic stress disorder has historically been associated with many stigmas and judgment. It was originally called shell shock and combat neurosis because many people believed it was only in soldiers. It has also been common in women that have experienced sexual trauma. The military has often not been very accepting of stress related conditions that can be developed by veterans, and this condition has emerged very recently and been accepted by our culture and society, which has shown the conversation of mental health has started to be more prevalent in our culture. For Katniss, one of her main symptoms is that she has a lot of nightmares about the trauma that she lived in the arena during the Hunger Games. The DSM-5 lists that one of the intrusion symptoms related to PTSD is constant nightmares where the content in the dream is related to the traumatic event. Nightmares and intrusive memories can emerge in PTSD patients, and in the opening scene of Mockingjay Part 1, Katniss is found hiding in an area which she is not allowed to be in because she just had a nightmare about what was happening in the arena. Another symptom that she has is that during the revolution against the Capitol, Katniss often believes that it is her fault that so many people are being killed and hurt. She especially believes this about Peta, who is being tortured in the Capitol. She says he, which is President Snow, who is the president of the Capitol and torturing people, warned me about this. He's doing this because I'm the Mockingjay. He's punishing Peta because of me. In reality, President Snow is just punishing the whole country because of her rebellion, but Katniss believes that these consequences are completely her fault. In the DSM-5, they list persistent distorted cognitions about the cause or consequences of the trauma that lead the individual to blame themselves as a symptom of PTSD. Another component of PTSD is the patient suffering from feeling blame for the consequences of the event. This is how Katniss is constantly blaming herself for the consequences of what is happening rather than actually seeing the reality. A symptom that Katniss doesn't show is the inability to remember an important aspect of the traumatic event. She seems to remember all of the brutal details of her horrible event. The DSM-5 lists this forgetting of important events during the traumatic event as a symptom of PTSD. For the treatment plan, I would treat her with prolonged exposure therapy, which is basically where she is able to confront her memories that are traumatic to her and help her heal. This would be twice weekly and last 90 minutes long. There are some ethical concerns because it helps the patient, but it can be very scary for them. I think that one of the barriers that could hinder Katniss from receiving this treatment is that there are not a lot of properly trained therapists in their society or country. How does this movie portray PTSD? I think that Katniss shows us a lot of the symptoms and pain that people face when they have PTSD. A lot of people that have PTSD from wars probably connect to this movie because is related a lot of their PTSD is related to similar things that Katniss faced, such as being in a war. I think that Katniss being able to lead a rebellion is a little inaccurate for this disorder because many people who suffer from this are not able to even do daily tasks. Films that correctly portray these disorders can give people that suffer from these disorders something to connect with and make them feel less alone and isolated. These movies can also help watchers better understand these disorders and connect with people in their lives that may struggle with them. These are my references.